Meet Petra, who has been working as a nurse for over 25 years. She is seen by her colleagues as an expert in her field of nursing and serves as a mentor to other nurses newer to the profession. Early in her career, Petra was not as confident about how to manage challenging situations and relied on other, more experienced staff to help and learn from. She spent more time checking the hospital policies back then and was careful to follow them as she was worried about making mistakes and risking patient safety. The way she assesses her patients has changed. She used to use the assessment tools to identify patient needs, but now she is able to assess those needs quickly and document them. This way of working makes sense to her and feels more natural. She also adapts how she manages different situations, sometimes outside of exactly what the policies suggest. She worries that she should not be doing that, but it seems to work effectively and results in safe outcomes. The time it takes to complete all the required documentation and other reporting regulations has started to really frustrate her. More and more, she finds her time devoted to documentation and less time with her patients. She understands the need to make sure that the care she delivers is documented, but there seems to be more requirements that she does not believe contribute to making care safer for her patients. Increasingly, there seems to be a disconnect between what we are required to do every day and what is realistically achievable. Changes are often implemented that repeat other documentation practices that we already do. Sometimes the requirements don't seem to make sense. She recognises when there are things going wrong that management need to make changes, but the changes come from above and don't seem to really understand the cause of those problems. It's difficult to keep positive, and some days I dread going to work. We need someone to look closely and say, we know it's challenging, let's try to make things easier for you, and actually ask us what we need to do that. There are lots of things we do in our daily practices that could be done differently or not at all that would free up time to focus on our patients. Petra's story demonstrates how clinicians may perceive the way they are guided to practice and how decisions made about systems of care are experienced locally. While the perceptions of those delivering care are vital, there are other requirements at the institutional levels that must also be considered. As the complexity of the healthcare system grows, there is a risk that the perspective of clinicians is lost and the impact of practice requirements fails to be recognised, especially where those requirements contribute to more risk. Policies and procedures created to guide practice cannot address every clinical scenario. Clinicians adapt every day to different scenarios, challenges, and resources. While they tend to work within the policies and procedures, it is their ability to adapt that contributes to safe outcomes. In the past, healthcare systems have tried to limit adaptations in practice, seeing it as increasing risk. But in reality, those adaptations are what keep people safe in the vast majority of cases. As the complexity of healthcare grows, many of the activities and ways of working we ask clinicians to do are intended to lower risk. But a type of safety clutter has been created, where some of those actions actually increase the risks they are intended to prevent, resulting in unintended consequences. The time it takes clinicians to document care has begun to reprioritise their focus, limiting their capacity to deliver care. They often sense a tension between wanting more time to deliver care rather than spend time engaging with documentation and computers, but struggle with how to shift that balance. There is value in engaging with clinicians and reimagining how we ask them to work, document and deliver care, and identify how we can change the requirements to give them back capacity to deliver care in a way that makes sense to them while still balancing institutional requirements.